Hi winners, this is Dr. Srikanth from Team INBD Conquer. Now I'll be talking about one of the important topic in blood, that is blood clotting and the blood disorders. So the first important aspect that you have to make a note is the difference between the serum and plasma. The difference between the serum and plasma is serum is equal to plasma minus the clotting factors. Okay, so plasma is nothing but the fluid content of the blood. Okay, so blood has the major component as the plasma, that is the fluid content, and rest all are the cells that are present in the blood, which is WBC, RBC and the platelets. And as already discussed, the fluid portion of the blood is called as plasma, and the normal volume of plasma is 5% of the total body weight, which is roughly around like 3,500 ml in a 70 kg man. And if whole blood is allowed to clot and the clot is removed, then the leftover is called as serum, which we have already discussed. So the components of serum and plasma are same, except that fibrinogen and the clotting factors, specifically more oriented towards the clotting factors like 2, 5 and 8. But if you see, there will be high serotonin content, that is basically due to the breakdown of platelets during the process of clotting. The next comes are the factors, okay, that are factors that are associated with the clotting or clotting factors. They regularly ask the names of these clotting factors, or they may ask you which clotting factor is missing. You can see 5 here and you can see 7 here. Okay, sixth factor is missing, and they will ask you the names of the factors. That is, 1 is fibrinogen, 2 is prothrombin, 3 is thromboplastin, 4th is calcium ions. Okay, and these are the other names of the factor 5. Okay, and this is the factor 7, stable factor, that is factor 7. Most of your questions will move around the factor 8, that is, it's also called as anti-hemophilic factor. Okay, factor 9 is also called as anti-hemophilic B factor, which is also called as Christmas factor. And next comes is the factor 10, that is stored power factor. And next comes is the factor 11, that is plasma thromboplastin accident, that is called as factor C. Okay, and next comes are the factor 12 and the factor 13, that is glass factor is factor 12 and fibrin stabilizing factor is the factor 13. So it is mandatory that you have to make a note about the other names of the factors also, okay, because most of your questions move around this area. The next comes are the stages of blood clotting. So your blood clotting is divided into 3 stages. That is, stage 1 is the formation of prothrombin activator. Okay, whenever this prothrombin activator is activated, it's going to convert the thrombin, it is going to convert the prothrombin to thrombin. So that is the second one. And finally, the fibrinogen is converted into fibrin and the factor, the clot will be stabilized. So these are the 3 important stages in the blood clotting. Okay, so as you know that there are something called as extrinsic and the intrinsic pathways, right? So most of your questions will move around the extrinsic and the intrinsic pathways. So similarly, I want you to learn this in the most simplest way. Okay, so I want you to learn this in the most simplest way. Okay, what is that? One is the intrinsic factor, okay, and the second one is the extrinsic factor. So it's very simple that you can keep X here. Okay, simple way of denoting this. X means factor 10. Okay, so factor 10, first of all, your factor 12 is going to activate factor 11. Okay, factor 11 is going to activate the next one. What is 10? 10 is already there here. So factor 9 is going to activate factor 8 and factor 8 is going to activate factor 10. That is the intrinsic pathway sequence. And coming to the extrinsic, okay, we are done with 1, 2, we are done with 1, 1. Okay, we are done with 10 here, we are done with 9 here, we are done with 8 here. So 7 is missing. So it starts from 7 and it's going to activate the 10. So whenever factor 10 is activated, it's going to activate to factor 5, factor 5 to factor 2, factor 2 to factor 1. Easy to remember. 10, 5 into 2 is 10, 10 into 1 is 10. Okay, so it is 10. Okay, so simply you can denote it as intrinsic, extrinsic, that is 12, activates 11, activates 9, activates 8, 8 is going to activate 10. Extrinsic, 7 is going to activate 10. So whenever the 10 is activated, it's going to activate 5, 2, 1. So this numbering you have to remember so that most of your questions can be easily handled or easily answered. So we'll go to the picks that are given in the textbook or in our material. So we'll go. So what is this? Intrinsic pathways. Already studied the intrinsic pathway. First of all, it is activating the 12. Then it activates the 11. Then it activates the 9. 9 is going to activate the 8. 8 is going to activate the 10. Extrinsic pathway is going to activate 7. 7 is going to activate 10. Whenever 10 is activated, 10 is going to activate 5. 5 is going to activate 2. 2 is going to finally activate 1. That is 1 is nothing but fibrinogen. At the last step, the 13th factor is going to provide the stabilizing conversion of fibrinogen to fibrin. So this is in a sequence. So they are going to ask which all factors are involved in the extrinsic pathway, which all factors are involved in the intrinsic pathway, which all factors are involved in the common pathway is the most commonly asked question, which can be simply handled by you. Now you are very clear. I am writing again. Intrinsic starts from 12, activates 11. 11 is going to activate 9. 9 is going to activate 8. 8 is going to activate 10. 10 is going to activate 2. 2 is going to activate 5 is going to activate 2. 2 is going to activate 1. So extrinsic is 7 is going to activate 10. 10 is going to activate 5. 5 is going to activate 2. 2 is going to activate 1. Finally, the 1 will be stabilized by factor 13. I hope it's very clear now. Okay. The next level. Okay, this is taken from one of the standard book that most of us read. So I'm just going to repeat it again. 1, 2, 1, 1, 9, 10. Okay, so then it's going to activate 7. 7 is going to activate 10. 10 is going to activate 5. 5 is going to activate 2. 2 is going to activate 1. 1 in the presence of 13 is going to form the clot. Done. Clear. So these are done from two different textbooks which are most commonly referred by majority of the people. So this particular topic of clotting factor is very, very important when you're talking about pharmacology, because you have a topic called as anticoagulants. When you talk about physiology, because clotting is very important, physiology, and when you're talking about many other topics like general path and application based questions, because disorders of clotting factors are very, very important in our case based questions. Okay, so next comes is what is hemostasis. Okay, so there are different mechanisms by which the blood is moving. Okay, blood is not clotting. Whenever the blood comes out, it's going to clot, okay, because of the presence of clotting factors. But when the blood is in the blood vessels, it is not clotting. Okay, so what happens? Okay, so there are three mechanisms by which the clotting process is hammered, that clotting process begins. That is, first is vascular spasm. Okay, so whenever you have a trauma that's going to damage the blood vessels and it causes the spasm of the blood vessels, that is called as vascular spasm. And once the spasm is done, the platelets which are going to present there they're going to come and adhere to the damaged endothelium. Okay, so whenever they come and attaches to the damaged endothelium, they form something like a plug which is going to stop the bleeding. That is called as primary step. Okay, so what happens in the secondary step? Secondary step, when the platelet plug is formed, the next process is the clot begins. Okay, so clotting process is going to begin. So the clotting process is going to begin, and this clot is going to adhere to the platelet plug. That is called a secondary step. So the primary step is the platelet plug formation, and the secondary step is the clot, which is going to help to make this platelet plug strong. So this is roughly the primary and the secondary hemostasis. So the next important aspect is there are few investigations that you have to make a note, that you have to learn. The investigations is first is bleeding time. Okay, so most of your questions will move around bleeding and clotting time. So bleeding time is nothing but it's a test. The test that determines the ability of a blood vessel to vasoconstrict and the platelets to form a platelet plug is called as bleeding time. So regularly your bleeding time, it may varies from textbook to textbook and material to material. Okay, as I know that you are reading 2 or 3 different sources, it may vary slightly, but mostly it will be around this zone, that is 2 to 9 minutes. Okay, the range is 2 to 9 minutes. So prolong this number, okay, this value of 2 to 9 is going to increase whenever there is a decreasing in the platelet count. So you can see disorders which are associated with the platelets. Whenever the platelet count is decreased, your bleeding time is going to increase. Okay, so that's the bleeding time. The next comes is prothrombin time. Okay, this is the time required for the plasma to clot after an excess of thromboplastin and an optimum concentration of calcium are added to it. Okay, so it is basically concerned with the extrinsic pathway and the common pathway. So we have already learned, so your prothrombin time basically represents the extrinsic and common pathways. Okay, so what happens whenever there is a prolonged, when it's going to happen, it's going to happen in the common. What are the factors that are present in the common? The common factors are present in the common are 5 to 1. So it's already discussed that it is associated with the common. So whenever you have a deficiency of these factors, this value is going to increase. So next question is, what are the clotting factors which are exclusive to that extrinsic pathway? Is already we have learned, that is 7 and 10. So it is associated with 7, 10, 5, 2, 1. So whenever there is a deficiency of these factors, this particular value is going to increase. So what is the normal value? It moves around like 11 to 13 seconds. So it is most commonly used to monitor the oral anticoagulant therapy. Whenever the patient is going to have an oral anticoagulant therapy, you're going to monitor this particular value, that is called as prothrombin time. The next goes is whenever this prothrombin time is going to increase. So it's going to increase in vitamin K deficiency, because vitamin K is necessary for the production of clotting factors, and it's going to help in the formation of prothrombin. So that's the reason why. So whenever there is a vitamin deficiency, K vitamin deficiency, there will be elevated of PT value. So apart from this, DCI, disseminated intravascular coagulation, is another condition where you can see increasing in this PT value. Whenever there is a liver diseases, because liver diseases indirectly is going to cause, because vitamin K is synthesized in the liver. So again, indirectly it's going to cause the deficiency of the factors, which leads to increasing in PT. As you know that the most commonly used oral anticoagulant is warfarin, right? So whenever there is usage of warfarin, you can see there is increasing in the PT value. So you can see this is the most common application based question for you. They will ask the conditions where there is increasing in the PT value. Next comes is the partial prothromboplastin time. So partial prothromboplastin or activated partial prothromboplastin time, okay, is a performance indicator that measures the efficiency of both intrinsic as well as the extrinsic pathway. Previously we are talking about intrinsic pathway when I am talking about PT value. Now this APTT is going to give an estimation of the intrinsic and common pathway. So this is most commonly used in monitoring the heparin therapy. In which factors? All the factors which comes in intrinsic. What are the factors which comes in intrinsic? Comes in intrinsic are 12 followed by 11 followed by 8 followed by 9 followed by 8, 8 followed by 10, 10 followed by your 2, 5, 5 followed by 2, 2 followed by 1. So this is what the sequence we have. So all these deficiencies, any of these deficiencies leads to the increasing in the partial prothrombin value, and the average value ranges from 28 to 35 seconds. I hope it's very clear. So next comes is thrombin time. So thrombin time is the time taken for the clot to occur when thrombin is added to the plasma. So how much time it is going to take. This tests the conversion of fibrinogen to fibrin and depends upon the adequate fibrinogen levels. Basically it depends upon the adequate fibrinogen levels. Whenever the fibrinogen levels are decreased, this thrombin time is going to increase. Normally it ranges from 15 to 20 seconds. So we have learned bleeding time, we have learned prothrombin time, we have learned thrombin time, we have learned activated thromboplastin time also. So as already discussed, coming to the extrinsic pathway, which will be increasing, your extrinsic pathway is going to cause an increasing in the prothrombin time. whereas the intrinsic pathway is going to increase the activated or partially activated thromboplastin time. And common pathway causes the increasing in the both two, because in both these parameters 5 to 1 are common is 5 to 1. So whenever you have this is going to increase. So as already discussed, okay, so I'm just going to discuss few important aspects. So the most important aspect in the list is your clotting factors. Okay, so there are few diseases that are associated with the deficiency of few clotting factors. So hope we have learned this. So hemophilia A is due to the deficiency of clotting factor 8, and hemophilia B or Christmas factor is due to the deficiency of clotting factor B, and clotting factor 11 deficiency leads to hemophilia C. There is something called as parahemophilia. So parahemophilia is due to the deficiency of clotting factor 5. There is something called as pseudohemophilia, which looks like hemophilia but called as pseudohemophilia. Your pseudohemophilia is nothing but von Willebrand disease. We'll learn some basics related to these diseases. Okay, so the utmost important thing is you have to learn about hemophilias, okay, and von Willebrand disease. What is the difference and what are the things that you have to take into consideration? Okay, 8 is A, 9 is B, 11 is C, para is 5, and pseudohemophilia is von Willebrand disease. Okay, clear. And make an important note that the most common genetic bleeding disorder is not hemophilia, it is von Willebrand disease. The most common genetic bleeding disorder is von Willebrand disease. That's a very, very important point that you have to make a note. Okay, so the next comes we're going to talk about the parameters, because mostly they're going to give a parameter and they're going to ask you. So your hemophilia A and your hemophilia B, okay, because there is the deficiency of what factors? The deficiency of factor 8 and 9. Okay, they are mainly concerned with the increasing in PTT. Okay, we have learned about this. Whereas your von Willebrand factor, okay, it's going to cause increasing in PTT and it's going to cause increasing in the bleeding time. Whereas here hemophilias, the bleeding time is the normal. And coming to the platelet problem, whenever there is a platelet problem, as already discussed, whenever there is a decreasing in the ability of a platelet's function or decreasing the number of platelets counts, there will be increasing in the bleeding time, because bleeding time is mainly concerned with the platelet function. Okay, the next important is whenever you talk about hemophilia A and B, and these are sex-linked recessive diseases. These are sex-linked recessive things. Okay, these are sex-linked recessive things. And whenever you talk about hemophilia C, the mode of occurrence of hemophilia C is autosomal recessive. Okay, it's autosomal recessive. This is sex-linked recessive. Okay, this is sex-linked recessive. In sex-linked recessive, what happens? The most commonly, as an X-linked recessive, males are most commonly affected. Whereas females, as they have only one X chromosomes, they are considered as carriers. Okay. Whereas in the case of hemophilia C, it is autosomal recessive. And even in your parahemophilia, which we have discussed, the parahemophilia, where it is the mode of inheritance is autosomal recessive. Okay, your parahemophilia is autosomal recessive, and your hemophilia C is autosomal recessive. Hemophilia A and B are sex-linked, X-linked recessive. Whereas coming to your von Willebrand, okay, von Willebrand is autosomal dominant. Okay, so all of these, okay, the mode of inheritance is hereditary. Okay, so there are few disorders which are hereditary. What are they? This is hereditary, this is hereditary, all these are hereditary. They are by genetic transformation. Among this, the most commonly occurring is von Willebrand factor. Whenever you have vitamin K deficiency, whenever you have hepatic problems, that is liver problems where you cannot secrete vitamin K, which is required for clotting, or whenever you have DIC, that is disseminated intravascular coagulation, because of any etiology, because DIC can occur in many etiologies, even in few infections, DIC occur. All these are acquired. Okay, you have two categories. One is hereditary. All these are hereditary, and the second one is acquired. Okay, that is acquired bias due to some etiology, which will lead to decreasing in the efficiency of the clotting. Okay, I hope now it is clear, right? So other important points that you have to make a note is hemophilia A is called as classic hemophilia, and it is the most common among the list of types of hemophilia. And if you want, you can add a note that hemophilia C is basically due to the deficiency of clotting factor 11, and it is also called as Rosenthal syndrome. Okay, it's also called as Rosenthal syndrome. It's not a sex linked. It is an autosomal recessive. It has an autosomal recessive characteristic feature. Okay, I hope you're very clear about this. So next we need to add a note about anticoagulants, right? We're talking like how these parameters are going to be useful. Like, so that is called as anticoagulants. Okay, substance which prevent or postpone the coagulation of blood are called as anticoagulants. There are three types of anticoagulants. One, anticoagulants which are used to prevent the clotting of blood inside the body. They are called as in vivo. So in vivo means inside the body. So that's very important because it's again a question for you regularly asked. What is in vivo? In vivo is inside the body. And the coagulants which prevents the blood clotting that is collected from the body, means outside the body, is called as in vitro. Okay, in vitro is outside the body, in vivo is inside the body. And the anticoagulants which prevents the clotting both inside and outside are called as in vitro and in vivo. So just make a note. So these are the three categories, and this particular table is very important in your pharmacology point of view. Okay, so your anticoagulants, okay, your anticoagulants are categorized into they are parentally given and few are orally given. Okay, so there are two categories, so that you have to make a note. That is indirect thrombin inhibitors and direct thrombin inhibitors. You have to make a note. Okay, mostly your question will move around. Heparin comes under indirect thrombin inhibitor. Okay, so here the most commonly asked question for you is warfarin. Most commonly used is the warfarin. They will ask you the different categories: direct factor XA inhibitor or oral direct thrombin inhibitor. So all these are the regularly asked questions for you. So please do practice this classification, which is as already told, like before I begin this session, I told it's a combination. Okay, your blood is a combination where you have to learn in your pharma, where you have to learn in your physio, where you have to learn in your path, and where you have to learn it everywhere. Okay, so this is going to this is an important topic which has to be covered from multi-directional point of view. I hope you're very clear about this. So I'm done for now. Signing off, Dr. Srikanth from Team INBD Conk.